Did you know that between 65% and 97% of mental health diagnoses could be wrong? Yes, you heard it right. Misdiagnosis of mental illnesses is unfortunately more prevalent than we'd like to think. Diagnosing mental illness is often not as straightforward. Imagine being diagnosed with an illness and receiving treatment only to discover months, even years, later that it wasn't the correct diagnosis. Misdiagnosis of mental health conditions is often detrimental, delaying appropriate treatments as well as adding unnecessary stress and stigma. In today's video, we will explore why mental health diagnoses are so often misinterpreted, the disorders most frequently misdiagnosed, and what you can do to ensure an accurate diagnosis is made. Mental health diagnoses can be challenging as they rely heavily on subjective judgment and reported symptoms, rather than objective tests like those used to detect physical illnesses, as mental disorders share common characteristics. Anxiety can easily be mistaken for ADHD, while depression often resembles bipolar disorder. Misinterpreting symptoms can easily occur and often lead to misdiagnoses. Failing to investigate causes rather than surface symptoms often leads to incorrect diagnoses that delay effective treatment for mental conditions. So, what are some of the most frequently misdiagnosed mental health conditions? Let's take a closer look at some of these misunderstood disorders. Bipolar disorder. Bipolar disorder is one of the most frequently misdiagnosed mental health conditions. One challenge in diagnosing bipolar disorder lies in its fluctuating presentation. For instance, bipolar disorder can be challenging to identify due to its symptoms overlapping with those of other conditions, and it is easy to misinterpret an episode of mania or hypomania as something else. For example, during the manic phase, an individual might display impulsive behavior or experience increased energy that can easily be mistaken for ADHD, or even personality disorders like narcissistic personality disorder. Furthermore, evaluation processes do not always observe manic episodes correctly, leading to misdiagnoses of bipolar disorder itself. Borderline personality disorder. Borderline personality disorder, BPD, is another condition that often goes misdiagnosed. Many of its symptoms, including emotional dysregulation, impulsivity, and unstable relationships, overlap with bipolar disorder or depression. However, BPD is actually classified as a personality disorder rather than a mood condition. Consultants frequently fail to differentiate between bipolar disorder and borderline personality disorder, even though both disorders exhibit similar emotional dysregulation symptoms, including mood swings or impulsive behaviors. Yet BPD goes much deeper into how one interacts with others and themselves than just mood fluctuations, leading to ineffective treatments such as medication for bipolar disorder instead of therapy to address emotional regulation patterns characteristic of BPD. ADHD and anxiety. ADHD is often misdiagnosed or entirely overlooked for its many similarities with anxiety disorders like depression. Symptoms like inattention, distractibility, restlessness, and irritability are present across both disorders. Anxiety often presents in ways that mimic ADHD symptoms. A person experiencing anxiety might struggle to focus or complete tasks, while restlessness could contribute to hyperactivity. Due to these overlaps in symptoms, it can be easy for someone with anxiety disorder to be mistakenly diagnosed as ADHD, despite actually experiencing it instead. Furthermore, dual diagnoses are possible. Someone could have both ADH and anxiety conditions simultaneously. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder is often misdiagnosed or undiagnosed altogether, often following exposure to trauma such as war, sexual assault, or natural disasters. While its symptoms, hypervigilance, anxiety, depression, and irritability could easily be misinterpreted as other mental health disorders like GAD or depression. One of the challenges associated with PTSD is its insidiousness. Patients may fail to identify and disclose any trauma that contributed to its symptoms immediately. Sometimes, it may be too painful for them to discuss it openly. In other cases, they don't realize just how severely it has affected their mental well-being. Without all available information, it can be challenging to make an accurate diagnosis. PTSD can often be misdiagnosed, with clinicians ascribing symptoms of anxiety or depression to an individual having experienced trauma, even though no such event has taken place. Anxiety disorders. Anxiety is one of the most frequently diagnosed mental health conditions, yet often misdiagnosed as ADHD, depression, or certain personality disorders. Children who struggle with anxiety often exhibit symptoms like difficulty focusing, forgetfulness, and fidgeting, all classic signs of ADHD that could be misdiagnosed. Furthermore, anxious children may become withdrawn or depressed, which could result in misdiagnosis. Adults suffering from anxiety disorders may also display restlessness and difficulty focusing, symptoms that overlap with ADHD. Because there are multiple symptoms present at once, diagnosis becomes all the more challenging. How to spot misdiagnosis? Here is the kicker. Fortunately, there are many ways you can avoid misdiagnosis. Here are a few key signs to watch out for if you suspect your diagnosis might be incorrect. Ineffective treatment. If the treatments you've tried haven't had any impact despite giving them time to work, this could be a telltale sign that your diagnosis is inaccurate and treatment plans don't address the root cause of symptoms properly. Second opinions. Always seek a second opinion when diagnosing mental health disorders. Diagnoses can sometimes change over time and should be assessed again as symptoms change. Family history. Mental health conditions often run in families. If your immediate relatives share similar symptoms or diagnoses, this can provide invaluable context and assistance with more precise diagnoses. Symptom overlap. Take time to educate yourself on the symptoms that are often confused with one another. ADHD, anxiety, depression, and PTSD usually share similar signs, so it's essential that your healthcare provider takes all possibilities into consideration when diagnosing and treating you. Search for context. Life events, stressors, and environment all play an essential part in mental health, so it is essential that clinicians consider all of your life circumstances rather than simply treating symptoms in isolation. Misdiagnosis of mental illness is no longer something we can ignore, as we've seen. Due to overlaps of symptoms and the subjective nature of the diagnosis, misdiagnosis is far too easy. But by being mindful of these issues and actively engaging with healthcare providers, you can reduce the chances of misdiagnosis and receive personalized treatments tailored specifically for you. Trust your instincts if something seems off. Seek care and answers immediately if something seems wrong with your mental well-being. Thanks for watching. If you found it helpful, make sure to like, share, and subscribe to keep you informed and updated.